Ron Duckworth here, looking forward to seeing you at EMS today and talking about something that you may not encounter every day in EMS, but something that I think you're still going to want to know about, and that's CHS, or cannabinoid hyperemesis syndrome, also sometimes known as scromiting or the anti-munchies. Now, you may not have heard of this before, but it's a new thing that we're experiencing a little bit more and more with current estimates of cannabinoid hyperemesis syndrome affecting potentially 2.7 million people in the US annually, including higher figures in states with legalization of marijuana. Now we know that regular medical and recreational use of cannabis is on the rise among all age groups in the US, and in most cases this doesn't produce a whole lot of side effects, but some regular users experience a wildly paradoxical reaction. Now, we're familiar with the fact that cannabis normally suppresses nausea and pain and stimulates appetite. But weekly or even more regular use of cannabis can produce severe cramping, abdominal pain, vomiting, and nausea. This is known as cannabinoid hyperemesis syndrome. We're going to talk more about this and the fact that CHS can produce kidney failure, electrolyte imbalance, skin burns. We're going to talk about the acute and chronic hazards presented by cannabinoid hyperemesis syndrome. We're going to discuss the 3 phases of CHS. We're going to identify different pre-hospital signs and symptoms. And although it's not completely known exactly what the pathogenesis is, we're going to talk about that. And especially I want to be able to have you share your experiences. Have you experienced, people in your service found patients with CHS? How did you deal with it? Does your local medical director know what this is? How do we keep EMS prepared to work properly on the streets? That's all of what EMS Today is about. So I look forward to talking to you about CHS, cannabinoid hyperemesis syndrome, at EMS Today.